I see patients every single week who sit in my clinic, completely devastated by a new Crohn's disease diagnosis, convinced their life as they know it is over. They picture endless hospital stays, heavily restricted diets, and the inevitable fear of major surgery. Let me tell you right now that does not have to be your reality. If you or someone you love has just been diagnosed with Crohn's, I know exactly how much of a shock that can be. You are probably sitting there feeling incredibly anxious and entirely unsure about what comes next. But I want to tell you one crucial thing. You do not need to face this alone. There are more than 200,000 people in the UK currently living with Crohn's, navigating the exact same worries that you have right now. I'm Dr. Kapil Dhingra, and as a consultant gastroenterologist, my goal is to give you the trusted, expert medical information you need to take control of your health. Today, we are doing a deep dive. We are going to walk through everything you know to know about Crohn's disease. We'll cover exactly what is misfiring inside your gut, the unseen complications that affect the rest of your body, and the incredible revolutionary treatments we have available today to get your life back on track. Let us start with the most fundamental question. What exactly is happening inside your body? Crohn's is what we call inflammatory bowel disease or IBD. Essentially, your immune system, which is supposed to act as your body's specialized defense force to protect you against infections, simply stops working properly. Instead of fighting off outside invaders, your immune system goes rogue and starts attacking your own gut. This friendly fire causes painful ulcers and heavy inflammation. And while it is called an inflammatory bowel disease, the reality is that Crohn's can affect any part of your digestive system, all the way from your mouth right down to your bottom. Mostly, however, we see it in the small bowel and the colon. Because the walls of your bowel are made up of multiple complex layers, this inflammation can go incredibly deep, affecting the inner, middle, and outer layer of gut simultaneously. This deep inflammation profoundly changes how your body handles food, digests nutrients, and gets rid of waste. Now, almost every patient I sit across from will eventually ask me, Doctor, did I cause this? Patients carry an immense amount of guilt, worrying that something they ate years ago or a lifestyle choice they made brought this condition upon them. Let me be incredibly clear with you. There is absolutely no evidence that any particular food causes Crohn's disease. We actually believe it is a highly complex combination of your genetics, problems with your immune system, shifts in the natural bacteria that live inside your gut, and an external environmental trigger. Researchers have identified more than 200 genetic variations that can affect this risk. So please drop the guilt. You did not do this to yourself. Because Crohn's can strike anywhere in the digestive tract, everyone experiences this disease completely differently. It is a lifelong condition filled with unpredictable ups and downs. You will have periods of fantastic health, which we call remission, where your symptoms disappear and your gut heals, but you'll also have times when the symptoms come rolling back, which we call active disease, a relapse, or a flare up. During a flare up, you might experiencing passing loose a poo, which is more than normal for you, and sometimes that poo may be mixed with mucus, pus, or blood. You might have severe abdominal pain and an extreme urgency to reach the toilet quickly, which I know can make leaving the house feel terrifying. But it is not just about the bathroom. This ongoing inflammation actively stops your body from absorbing vital nutrients from your food. This leads to unexplained weight loss and a crushing extreme tiredness known as fatigue. Many patients also do develop anemia simply because their body does not have enough healthy red blood cells to carry oxygen around, either due to poor absorption or blood loss. The specific symptoms you have often depend entirely on exactly where the Crohn's is located. If it affects a small bowel, you will likely experience bloating, tummy cramps when you are pooing, The most common form of the disease is called terminal ileal Crohn's, which affects the very end of your small bowel. If only your large bowel is inflamed, we refer to that as Crohn's colitis. And for some people, the inflammation focuses entirely around the anus, which is called perianal Crohn's. This can cause incredibly painful skin tears called fissures, fleshy skin tags, or swollen collection of pus called abscesses. Over time, this continuous cycle of severe inflammation and healing can cause significant physical complications inside your gut. One major issue we closely monitor for is a stricture. As ongoing inflammation or scar tissue builds up, it creates a very narrow section in your bowel. A stricture makes it extremely difficult for food to pass through, and if it becomes very narrow, it can cause highly painful blockages. Another very common complication affecting about 1 in 3 people with Crohn's is something called a fistula. A fistula is basically an abnormal tunnel that develops and connects your gut to another organ like the bladder, the vagina, or even right through to the skin near your bottom. These perianal fistulas appear as tiny openings in the skin that can leak pus or poo, and they are incredibly sore and painful, especially when you sit down or move around. They usually do not get better on their own and require specific medical treatments or surgery. What surprises so many of my patients is that Crohn's does not just stay in the gut. It can affect your eyes, it can affect your skin, your joints. Before we dive into exactly how that happens, I want to hear from you. What is the strangest non gut symptom you have experienced since your diagnosis? Let me know in the comments down below. I'll be reading and replying. And it helps the newly diagnosed patients see that they are not alone. So let's talk about those symptoms outside the gut. Up to 1 in every 2 people with Crohn's will develop problems in totally different part of the body known as extraintestinal manifestations. You might experience severe joint pain or swelling that improves when we get your gut under control. You could develop painful raised red swellings on your legs, a skin condition called erythema nodosum, or deep skin blisters called pyoderma gangrenosum. Your eyes might become incredibly red, itchy, and sensitive to light due to conditions called episcleritis or uveitis, which can require urgent treatment to prevent vision loss. Even your bones can be heavily affected. The ongoing inflammation, poor calcium absorption, and taking steroids medication can lead to thinner, weaker bones known as osteoporosis. To figure out exactly what is happening in your specific case, your medical team will run an arsenal of tests to monitor your Crohn's. We look at your blood to check for inflammation and anemia. We use stool tests like the fecal calprotectin test to look directly for signs of active inflammation in the gut. We will frequently use endoscopies which is passing a thin flexible tube with a camera either down your throat for a gastroscopy or up through your bottom for a colonoscopy to inspect the large bowel. We also heavily rely on MRI and CT scan to build a cross-sectional image of your digestive tract to pinpoint the exact locations of the disease. So, how do we fight back? While unfortunately there is no cure right now, the aim of our medical treatment is to stop the inflammation in your gut, ease your symptoms, and drastically reduce the risk of long-term complications. Often our very first line of defense is to quickly get a severe flare-up under control with steroids like prednisolone and budesonide. These act fast to reduce inflammation, but they cannot be used to control Crohn's long term because of their side effects. To keep the disease under control for the long haul, we transition to immunosuppressants, which could be in the form of medications like azathioprine, mercaptopurine, or methotrexate. These are daily tablets that gently dampen your immune response to prevent future flare-ups, allowing you to stop taking steroids. We also have medications called biologics and targeted medications like infliximab, adalimumab, vedolizumab, ustekinumab, or medications which we call JAK inhibitors. These are advanced revolutionary treatments given by either injection, infusion, or tablets that specifically block the exact proteins and chemical pathways causing your inflammation. They are absolute game changers in modern gastroenterology. For some patients, particularly children and young adults, we use a highly specialized nutrition treatment called exclusive liquid diet. This provides all the necessary nutrients a child needs to grow properly while giving the gut a complete rest so that it can heal, and it works incredibly well without the need of steroids. However, if the medications are simply not working, or if you have developed severe complications like tight strictures or painful fistulas, surgery might be the absolute best and healthiest option for you. Surgeons can perform a stricturoplasty to widen a narrowing section or a resection to completely remove the diseased part of the bowel. In some cases, you may need a stoma, which is an opening on your tummy wall that brings your bowel to the outside, allowing waste to collect safely in a bag. I want to stress this: a stoma is never a failure. It can be a life saving and completely life changing procedure, and many people live full, incredibly happy lives with a stoma bag. Finally, we have to talk about the mental and emotional toll of this disease, because taking care of your mental health is just as important as taking care of your physical bowel. Research clearly shows that people living with Crohn's are twice as likely to experience severe mental health problems like anxiety and depression compared to the general population. It is incredibly normal to feel frustrated, angry, ashamed, or downright scared about living with this unpredictable condition and its distressing symptoms. Please give yourself the time and space to accept these feelings. It is not a sign of weakness to struggle with a long term illness. Never be afraid to reach out to your specialist team, a psychologist, or support networks like Crohn's and Colitis UK for help. You can absolutely still exercise. In fact, regular physical activity can dramatically improve your mental well being, improve your sleep, and reduce the crushing fatigue. And if you're looking to start a family, know that if your disease is well controlled, your fertility levels are likely just as normal as everyone else. And most people with controlled Crohn's go on to have completely healthy pregnancies and healthy babies. Living with Crohn's disease is a lifelong journey, but I promise you, it is a journey you do not have to walk alone. Your healthcare team is here to support you every single step of the way. If you found this guide helpful, please hit the subscribe button for more honest and consultant level advice on taking care of your gut health. Stay strong, stay informed, and see you in the next video. Thank you.